Okay, my name is Alyssa, and I am going to show you how to give an oral medication. Um, First, we would verify the healthcare provider's orders and to see if there's any allergies that will, affect the medication given. And then, after I verified it and nothing's going to affect it, we're supposed to give it. I'll gather my supplies. Let's just say this is, you want to have, a lot of times they already have water. Nursing homes, they have water on the medication carts. So I say I have my water and my medication cup. I know it's like this big, the medication cups, and way smaller, but we're just using that. And then say some gloves, because you don't want to handle medications without gloves, I'm guessing. Okay, so I got my supplies. I'm going to prepare my medications now. By that, I will have to follow the 7 steps, which is, let's make sure it's the right patient, the right medication, it's the right time, it's the right dose, route, the right indication on why they should give it and what we're giving it for, and then the right documentation. So after we did that, we would make sure we pick the correct medication, which let's just say I have this medication, and I would compare it to a MAR and make sure everything's correct on it. After that, I would look at the expiration date. This says 2/21, so still it's not expired, so it's good to give. And then I would, I guess if there's a label on it already, if I made a label for it, I would take the patient's MAR and make sure that is correct, what it says on the MAR and to the medication. So that would be my second check. I'm making sure that's the right med. And then I would, okay, so if it's a unit dose med, it's already prepackaged with the name of the medication and the dosage. So all I would do is compare that label to the MAR, and then I would leave it in the packaging, and I would just put it in the med cup. You do that if you have several. You'll put it in the med cup, and then you will be ready to go. Oh, I forgot to mention, before you start preparing your meds, wash your hands, okay? Or sanitize. Wash your hands, sanitize. Okay, then when you're done preparing it, you'll knock on the door. If you shut it and pull the curtain, you provide privacy. And then you'll wash your hands again. And then you will introduce yourself to the patient or the family. And then you'll verify, you'll say, can you give me your name and date of birth and allergies? You'll just want to recheck with the allergies, and they give you what you need. And then you'll do any pre-assessments for if it's a specific drug that you're giving. Sometimes they'll want you to do the vitals before you give it, because that might indicate if they're like low or too high. You don't want to give that med because they'll make it higher or make it lower, vice versa. So that all checked out, and then I will check again, my third medication check. So I will pull up the MAR, make sure that is the right person on this MAR that I have, and this is the right medication, dosage, and everything on the MAR that it wants me to give. So all this looks all the same. So that's usually all correct, and so I'm going to proceed to give it to her. So everything's correct. I'm ready to move on to educating the patient. So I would tell them, like, hey, this med, like say something, I would give a med that helps lower the blood pressure. I'll be like, this is for your blood pressure pill. This is a blood pressure pill, whatever name it would be. I'm giving it to you so it'll help your blood pressure stay low and it won't go too high, because that would be dangerous. And then I would let her know the side effects of it and what's normal and then what is not good. And then I would say, do you have any questions about this medication? And then we proceed. If she says no or yes, then whatever questions would be answered. So I would have her sitting up, and then I'll give her the medication cup, and then she can read the label if she wants to, and then she'll unwrap it. I would also offer her a drink to help swallow, unless it contradicts it. But usually you're okay. And I will stay with the patient in the room until she has finished all her meds. She has swallowed them all. And I would see if she has any allergic reaction to them. Okay, she does not. Next, I would take all the supplies that I gave her and threw them away and wash my hands. Well, I would lower her bed in a comfortable position, and I would ask her if she needs any toiletries or personal items for her that she can reach. If she says yes, I'll give them to her. If she says no, I'll proceed. And then I would lower her bed. Well, I'll give her a call light. And if she doesn't know how to use it, I'll show her how to use it. And then I would put her side rail up if it needed to be up. Then I would lower her bed to the lowest position that's safe for her. And then I would leave hand hygiene document that right. I would document right after I give it. I don't want to document before I give it, because you never know what could happen. You always document after. So that is oral medication administration.